An emperor is marrying off a governor's daughter to a distant king in what's now Western China. And this girl is just nervous and a little bit scared sick. And on the road, she starts to get diarrhea. I don't know if you've ever had a road trip involving diarrhea, but it doesn't make for a very pleasant experience.
No, it doesn't sound fun.
In addition, she's in an area where the food is different, the climate's different. It's a very alien environment to everything that she's used to. She's accompanied by the royal physician, but the herbs that they brought with them aren't working. She already has really bad diarrhea. She's not absorbing anything very well. So, as the court physician, he's able to determine what plants are going to do, generally speaking, by their flavor, by their color, where they're found. And this is information we're going to be covering in later podcasts. This is the information that's been used for thousands of years to determine what a plant should do. But that doesn't mean that simply by following nature's general rules that you're going to know 100%. The young woman is part of the aristocracy, so the court physician doesn't dare make a mistake. If he fails to heal her, he could be losing his head. You can appreciate the dire circumstances of a 14-year-old girl with diarrhea in the back of a carriage, and if he fixes her, he gets to live. If he doesn't, he gets to die, but she can't absorb anything. He gets the herbs together, the usual suspects, the kind of herbs that are aromatic and maybe a little bit bland. But he doesn't dare give them to her orally. Instead, he creates a foot soak for her. She begins using the foot soak, and the herbs are able to absorb transdermally. Within a few weeks, she's completely back to her old self, in time for the wedding. Since that time, the herbal foot soak tradition began to spread really quickly within the Wusun area of China, and then throughout China as a whole.
We've had some interesting cases in the last couple of years treating patients primarily using foot soak. Andrew, do you remember the lady coming from Mayo Clinic?
Yeah, she was really sweet woman. It was very tragic. Originally, she had come from a cardiologist as a referral, and the cardiologist determined that her heart problems weren't really caused by her heart, but she suspected they were caused by deeper gut dysbiosis. After looking deeper and asking the right questions, it seemed that no matter what she had done in the past, whether she had taken out certain types of foods or added others, nothing seemed to help. So I asked about her menstrual history, and it was absolutely bonkers from the time she was very young. As a result of that, I asked further questions, and it seemed that her feet were always frigid. So I took a dramatically different approach. I had her start using herbal foot soaks, keeping in mind that her absorption for anything was really poor.
Yeah, she was diagnosed by Mayo Clinic with what?
It was pretty severe colitis among, irritable bowel syndrome,
Right.
general abdominal pain, this kind of thing.
Yeah, and they couldn't do anything. That's why they sent her home. But luckily that we were able to help her.
Yeah, she had really dramatic effects simply by coming in a few times a week and getting herbal foot soaks. Right away, her pain started to drop, her circulation improved, her menstruation returned to normal, and for the first time in a decade, she was able to have normal bowel movements. And within 3 months, then her heart complications had alleviated as well. So that was really beautiful because as complex as the problem was, we were able to alleviate it with something that was really enjoyable for her. Here's somebody who's gone through invasive exploratory, procedures for diagnostics. And in the end, she was coming in a few times a week, listening to her favorite music, having a luxurious foot soak, and gradually her symptoms were being alleviated.
There is a saying in China. It said, when a tree dies, it's the roots who die first. When a person ages, it is the feet that age first.
That's really fascinating and something that I didn't quite understand until we started working a lot with foot soaks. You often find people who look pretty healthy but have some internal condition that's chronic and keeps coming back. And you'll find a mysterious source of inflammation in the body. Now, if you think of the body like a snow globe, anything that's outside of the cells will tend to sediment downward. Also, the heart pumps by way of the arteries and pushes blood throughout the body, but it depends on our muscular movement to bring all of that blood back. Once we're injured or spending more time sitting down, we get really poor venous return. So the blood that's going out and getting used isn't coming back. So we get a lot of empty, dead blood. It's not carrying oxygen. It's not carrying much in the way of nutrients. And as a result, it will die. With this dead tissue that's starting to get really sticky, it's coagulating. This is what sets the stage for chronic inflammation, aging, and potential strokes and heart attacks. Once we get an area of the body where there's inflammation, like when the platelets in the body are sticky, that inflammation, that inflammatory reaction causes the immune system to engage, and it accelerates the aging process. So we can really see, just like a tree will start to rot at its base, we too will start to age and disintegrate by accumulating debris and garbage within our feet. This also interacts with the fascia of our feet. Our fascia and the muscles in our feet act like interlocking arches. And these arches are used as a way they kind of overlap and they're soft. So as you take a step with your foot naturally, it will create a spiral of force that goes through your body. This spiral of force is much easier on the joints and goes through the body. However, once you start to lose that plasticity in the feet, what tends to happen is that you get a zigzag of shock going from the ankle to the knee to the lower back to the neck. And what does this do? This makes you not want to feel like getting up and moving around so much, which is a vicious cycle that eventually can lead to many chronic diseases. What we found by having people do these foot soaks is that we're able to restore the conditions of the foot, and also doing the foot soak, the action of the heat and the herbs causes the heart to begin pumping a little bit faster. So it almost mimics going out for a hike or running around the block, even when people have a blown out knee or have just gone through surgery and can't engage in those exercises. They're really important, not just for our muscles, but for our lungs and our entire endocrine system. As a result of this, the foot soaks are incredibly good for blood pressure. In studies of around 30 people, blood pressure tends to drop about a half hour after the foot soaks begin. Should be noted though, if people have high blood pressure, doing the foot soaks for longer than 45 minutes can temporarily increase the blood pressure. It's also been shown to be good for diabetic neuropathy. In various controlled studies, the effective rate hangs around 75%. There are some people who it's extremely helpful for, and some people who it really doesn't do much for. It kind of depends on the stage of the diabetes and the damage to the nerve. For insomnia, preliminary trials have shown an effective rate of around 76%. Personally, I find it very, very comfortable, especially in winter. Have a little shot of warm rice wine, a foot soak, head right to bed. It's absolutely divine. For foot pain, microcirculation, enhancing metabolism, relieving fatigue, and increasing immune system function, it's been shown to be incredibly good. And most interestingly, I find, is that it can even help skin conditions like acne or rosacea. There are effects on the entire endocrine system by improving the blood circulation. As useful as they are, there are times when they're not advisable. Anything that's going to cause real change to the body will have both positive and potentially negative effects if the wrong people use them at the wrong times. Foot soaks are not advisable if you're hungry or have a history of getting sudden low blood sugar crashes. It's generally not advised as a long-term strategy for children. There are exceptions to this, such as young children who are having constipation. They may get a foot soak one time, possibly twice. But in the long run, it's seen as being too warming for their bodies. It's important to avoid doing them under drafts, under air conditioning or outside, anywhere where you might get a sudden temperature change, because it can have negative effects on the immune system. Make sure to avoid doing them within 30 minutes of having a meal. This is really not a good idea if you have metastatic cancer. Now, probably your doctor would say, yeah, don't do that. But remember, always check with your doctor. And if you have a disease that's going to be made worse by increasing circulation, then this entire therapy isn't appropriate for you. If you have a history of heart disease, cerebral hemorrhage, infection, if you have wounds or burns on the feet, bleeding, menstruation, sepsis, or neuropathies, doing foot soaks may not be appropriate for you. It's particularly important to use a thermometer and make sure that you have the right temperature when you're dealing with neuropathies. With neuropathies, people lose the sensations in their feet. They lose the ability to determine if it's too hot. So it's important to get a thermometer and make sure that you're staying at a temperature of about 110 degrees Fahrenheit. Lon, is there a way that you can describe for people at home how they can start to do a foot soak? What might be the best practices?
Let's start with water. The best water is said to be spring water, followed by flowing mountain water, then well water. The better the water quality, the more consistent and pure the herbal extraction process is.
So at home, am I okay with tap water?
Absolutely. The next is to get a water basin. In China, some go as far as the knees. The minimum requirement is that it covers the ankles.
Covers the ankles?
The ankles, thank you.
Yeah.
Wooden buckets are preferred because they insulate heat a lot better than others. Avoid bronze or iron.
Avoid bronze and iron?
Yes.
I don't have many bronze foot basins, but if I did get a really pretty bronze basin, what's the worst that could happen?
It may interact with herbs.
Okay, and how it interacts chemically, we just don't want to take the chance. So,
We just don't want to take the chance.
okay. So probably it will render the herbs kind of inert, but for various allergies and skin sensitivities, it's best just to fall in line with tradition on this one.
Right.
So no bronze, no iron. What about plastic? Am I going to pollute myself if I use plastic?
Plastic should be fine. The temperature, you want to keep it between 100 to 113 degrees, which is about 38 to 43 centigrades.
Can I just use a thermometer, a cooking thermometer for this?
Definitely. That would be actually the best and practical. At our clinic, we usually set the temperature at 110, which is very comfortable for patients.
And it's safe for the people with neuropathies.
That's right. And the time, you should control the time between 20 to 30 minutes for general health.
What happens after 30 minutes? Do I turn into a pumpkin?
I'm not sure about that, but better not.
Okay.
And for patients with chronic pain, hypertension, or hormonal imbalances, you can go a little bit longer for up to 45 minutes, but no longer than 45 minutes.
If your feet are in there for 45 minutes, wouldn't they cool off?
That's why you need to keep adding hot water.
Okay, so you want to maintain the temperature at about 110 or even increase it a little bit as you can tolerate it?
That's right.
Okay.
And also find a very comfortable chair for you to sit in so you can be relaxed and enjoy it. Try not to read a book or watch a TV or look at your cell phone.
Yeah, absolutely. It's ironic sometimes. You'll see people who are coming in for stress disorders that have caused a lot of problems within their body. They're getting the foot soak, and meanwhile, they're reading something political that's getting their blood boiling, or they're texting an ex, and you can just see the actions of what they're taking in emotionally are kind of working against the treatment. An exercise that we tell people to do is to pay attention to the heat distribution. Generally speaking, the first time people do a foot soak, they'll feel the heat going up over the ankles, maybe halfway up the shin, but they don't tend to feel it going throughout the body. As they begin doing foot soaks over a couple of weeks, they'll feel heat going up through to the kidneys and almost a pulsing between the kidneys and the toes. And eventually, the pulsing feeling will spread throughout their entire body as their body adjusts by increasing microcirculation. If you would like more information, references, or resources, please check us out at botanicalbiohacking.com. If you found this information valuable, please share it with your friends and family.